Healthcare is moving toward a workforce that emphasizes teamwork competencies and working in teams of providers to optimally meet patient healthcare needs. To be prepared for the realities of ongoing care delivery changes, health professions education is changing to include a greater focus on interprofessional education, preparing all health profession students to deliberately work together in order to build a better quality, more efficient, and safer healthcare system. In 2011, the core competencies for interprofessional collaborative practice were released and are being widely used as the basis for interprofessional education. This video is the first in a series of 4 videos designed to introduce preceptors, students, and faculty to the core competencies for interprofessional collaborative practice. These core competencies were developed by an expert panel made up of 6 health professions. All of the interprofessional competencies discussed in these videos are directly based on the core competencies for interprofessional collaborative practice report, which is available for free on the internet for download and is referenced at the end of the video. This video uses a patient scenario to illustrate the foundational components of the first competency, values and ethics for interprofessional practice. This competency centers on working from a base of shared values and mutual respect with individuals of other health professions to deliver patient and population-centered care. Shared interprofessional ethics is an important part of this competency and needs to be applied to delivering collaborative care. For example, how do we handle confidentiality inherent in the patient-practitioner relationship in the context of delivering team-based collaborative care? At the end of this training video, you'll be asked to answer a short series of questions about the first interprofessional collaborative practice competency. These questions will help you monitor your mastery of the competency presented. Let's get started. This patient scenario video centers around a patient who has decided with her healthcare team to stop chemotherapy, choosing to move to a totally palliative care approach. Her daughter, who lives out of town, is not supportive of the decision. Her daughter is visiting her mother for the purpose of reversing her mother's decision and resuming chemotherapy. Let's meet our actors. Meet Ella, a 78-year-old Caucasian female with diabetes who's been receiving treatment at the infusion center that is associated with an oncology practice. She lives independently at home. She was diagnosed with breast cancer 4 years ago, underwent a mastectomy, radiation, chemotherapy, and did quite well. 2 years ago, she developed metastasis to her lungs. Ella has an interprofessional collaborative team who's been working with her for 2 years. Ella has decided in collaboration with her team to stop further cancer treatments and transition to palliative care only and symptom management and control. She is relying on her Christian beliefs for additional comfort, wanting to be able to enjoy as much quality of life as she can, free from the distressing side effects of chemotherapy. Meet Karen, Ella's daughter, who lives out of state and has not been available to participate in the interprofessional team meetings involving her mother's care. Karen has just arrived for a short visit with her mom. She has recently been told about her mother's decision to transition to a palliative care approach. Karen is not happy. She is worried about her mother and wants to change her mind. Meet Jose, Ella's clinical nurse specialist. Clinical nurse specialists are advanced practice nurses who may have prescriptive privileges and are experts in a specialty area. Jose is an oncology clinical nurse specialist who works specifically with patients who have cancer, helping her manage symptoms. Jose has worked closely with Ella for over 2 years in the outpatient setting to ensure that she can stay at home where she wants to be. Meet Andrea, the oncology social worker. Oncology social workers are master's prepared mental health clinicians who have obtained a clinical license. Typically, they have received advanced training in psychosocial oncology and may also be certified as an oncology social worker. Andrea is both a licensed social worker and has certification in oncology social work. Meet Dr. Young. She is an assistant professor in the Department of Oncology. She trained in internal medicine for her residency and then completed a 3-year fellowship in oncology specializing in breast cancer. She has been a practicing oncologist for 10 years and has been caring for Ella for 4 years since she was diagnosed with her cancer. Meet Dr. Lee. Dr. Lee is a board-certified oncology pharmacist with experience in palliative care. A pharmacist certified in oncology has extensive training and experience in this specialty practice and has successfully met all qualifications for board certification. Dr. Lee specializes in managing the medication treatment plan for patients with malignant diseases.
My understanding from our last team meeting is that Ella has made the decision to transition to palliative care only and does not want to receive any further chemo. We will need to focus her care solely on pain and symptom management, comfort, and psychosocial care.
Yes, Ella feels that the chemotherapy side effects prevent her from living the life that she wants in the time that she has left. She's clearly stated she does not want further treatment. She is cognitively competent to make this decision and is very much aware exactly of what this means. Spiritually, she feels that she's ready to go whenever it is time to go. Unfortunately, her daughter is not in agreement. She arrived yesterday and did not seem very happy with the decision. She fears that we've given up on her mother.
You know, I've had a chance to review Ella's chemotherapeutic regimen as well as the other medications to assess whether any dosage adjustments are needed to help her better tolerate the treatment. She's already receiving all the medications necessary to help minimize toxicity from the chemo. Unfortunately, she continues to experience side effects from the treatment.
Dr. Lee, I appreciate your assessment of Ella's response to her chemo regimen. Well, there appears to be some concern about Ella's decision. Andrea, have you had a chance to meet with Ellen and her daughter? Do you think that we should have a family conference with them?
I did meet with Karen, Ella's daughter, when she arrived, and she's frightened about losing her mother and is trying to understand how her mom came to this decision. Because she is from out of town, the decision felt abrupt to her. She expressed concern that we are not doing all we can for her mom. She's afraid that her mom is giving up. She wants to make sure that all treatment options have been explored. This is a very common reaction for family members at the prospect of losing a loved one. I'm trying to be supportive of Karen's concern while also being sensitive to Ella's very personal decision. Ella told me that when her sister was facing losing her life from cancer, she chose to have everything done, and she really suffered. Ella has made it very clear that she does not want that or for her family to experience that. I think that we should have a family conference to help facilitate the conversation. Let me ask Ella if that's what she wants to do.
I think that's a great idea. It appears that her daughter Karen may not be supportive of this decision. Asking Ella will honor her right to direct her care.
Agreed, but we all need to be on the same page prior to this family meeting. Perhaps we should have a team meeting first. Let's try for 2 p.m. today. I'll make contact with the palliative care consult service to see if they can join us as well.
You know, I'll be glad to address Karen's concerns about her mother's chemo regimen and the toxicities that she's been experiencing, despite all measures at the family conference.
Great, and I will check with the infusion center nurse and staff to see if they think there is anyone else that should be included in this discussion. Oh, and I'll make sure everyone knows about the 2 p.m. planning meeting. In addition, I will make sure that everyone knows about the agenda. Let me make sure you are okay with what I'm going to say. This meeting is to discuss Ella's decision to go to the palliative care route. We're going to discuss what palliative care means, what Ella indicated she wants, her cognitive status. Then we're going to discuss any team members' concerns regarding this decision. Also, we are proposing to meet with Ella and Karen to ensure that they know the team supports Ella's decision. Does that sound right?
You got it.
Great.
This is a patient decision, and we need to make sure that we respect her decision and that she can trust us to support her decision. Getting together and talking this out will make our team stronger moving forward.
Agreed. You know, perhaps this conference will give us an opportunity to assess both Ella's readiness and Karen's acceptance of her mother's medication for pain and symptom control.
Yes, that sounds good. Andrea, if Ellen and Karen agree to have a family conference, will you be willing to co-facilitate with me?
I would be glad to. I will speak with Ella, and if she wants to have the family conference, I will talk to both Ella and Karen to identify their concerns and make sure that they are brought up during the family conference. Also, I will see if there is anybody else they would like to have at the conference, such as another relative or their clergy. It is very important that we support the family through this transition.
Interprofessional collaborative teams are critically important to the success of patient-centered care. Mutual respect, trust, respect for diversity, and individual professional expertise all contribute to a successful healthcare team where the patient is the central focus. Let's review what we saw illustrated in the scenario that applies to interprofessional competency under the values ethics for interprofessional practice. This discussion reflects some of the sub-competencies identified by the Interprofessional Education Collaborative in 2011. Patients and families are considered part of the interprofessional healthcare team, and as such, they are an integral part of this first interprofessional competency. For example, there are 3 sub-competencies under Values and Ethics for Interprofessional Practice competency domain that illustrate the role of patients and families on the healthcare team. Place the interest of patients and populations at the center of interprofessional healthcare delivery. Work in cooperation with those who receive care, those who provide care, and those who support the delivery of health services. Embrace the cultural diversity and individual differences that characterize patients, populations, and healthcare teams. In our scenario, we see that team members are focused on the patient's wishes, from big decisions like treatment options and moving to palliative care, to small decisions like whether we should hold a family team conference with her and her daughter. This demonstrates how the healthcare team is putting Ella at the center of the care. It also illustrates that the team is working in cooperation with Ella and embracing her individual differences, such as her desire to avoid the suffering she experienced when her sister decided to have everything done at the end of her life. As you can see by the team discussion, Ella is in control of the decisions about her care with the support of her healthcare team, rather than having her healthcare team just tell her what to do. Trust is critical to the effective functioning of the healthcare team. Trust develops over time as team members act with integrity and follow through on commitments to other members, feel that their expertise and input is valued, and actively participate in the decision-making. With trust comes mutual respect. Respect is demonstrated through confidence that team members show in each other, speaking positively about one's team, fellow team members, and team decisions. For example, there are 3 of the sub-competencies under Values and Ethics for Interprofessional Practice competency domain that illustrate the importance of trust and mutual respect as a foundation for the relationships on the healthcare team, which includes the patient and family. Developing a trusting relationship with patients, families, and other members of the healthcare team. This healthcare team has been working with Ella for 2 years now, providing adequate time and opportunity to build trust in each other and with Ella. Act with honesty and integrity in relationships with patients, families, and other team members. Respect the unique cultures, values, roles, and expertise of the other healthcare team members. For example, in our scenario, respect for the value and the role of the pharmacist, Dr. Lee, is demonstrated by the physician, Dr. Young, when she indicated she appreciates Dr. Lee's input about the patient's medication regimen. Another example demonstrating respect for the contributions of other healthcare team members' expertise is when the physician, Dr. Young, asked the social worker, Andrea, to co-facilitate the family conference. Each healthcare professional learns ethics and professionalism from the perspective of their own profession. What is different in this competency is the focus on ethics from an interprofessional, team-based perspective. We need to think through how team-based healthcare delivery affects our ethical decision-making. This is an emerging area of interest. For example, there are 3 sub-competencies under the Values Ethics for Interprofessional Practice competency domain that focus on incorporating interprofessional ethics into your collaborative team-based practice. Respect the dignity and privacy of patients while maintaining confidentiality in the delivery of team-based care. Demonstrate high standards of ethical conduct and quality of care in one's contributions to team-based care. Manage ethical dilemmas specific to interprofessional, patient, and population-centered care situations. The healthcare team is using a patient-centered approach which focuses on supporting Ella's autonomy to make informed decisions, in this case, moving to palliative care. They are also maintaining confidentiality by asking Ella if she wants a family conference with the team rather than any one healthcare team member trying to explain Ella's decision to her daughter without her input or consent.
Ella, Karen, we are so glad we had a time to meet together today and hear your concerns. This is a difficult time and we fully support your decision. Karen, do you have any more questions?
No, I understand now what my mom wants. I can see how palliative care is going to help her. I don't necessarily agree with her, but if it is what she wants, I'm going to respect her decision. And I'm glad that she has a team to support her.
Karen, we're going to be working very closely with your mother to help support her during this time, to help manage her symptoms and her pain, and to enhance her quality of life. We will be working very closely with Dr. Leon, the palliative care physician, to support you and your mom. We are also here for you, okay? The whole team is here to provide whatever you need during this transition. We are not giving up on her. It's very important to understand that. We are working with her to help her experience the best quality of life possible at this time. We will be right here with you the whole way, and if either of you want to meet us again, or Ella, at any point you decide you want to change your mind, we'll respect that too, and we'll be ready to work with you, okay?
Thank you for supporting me and helping Karen to understand my wishes. This has been a difficult time for her, and I think she knows that I just want to enjoy the time I have left and to be with family and with friends.
For more information on the IPE competencies, they can be accessed by the website on the screen.